Look, up in New Hampshire, the veterans I have talked with over the last few months are really excited about the passage of the PACT Act and the opportunities it provides to veterans. Understandably, at the same time, they really also have questions about the implementation and how the benefits are going to be delivered. So I would just want to focus on some of those concerns. And I'll start with a question to both of you, Dr. Elnahal and Mr. Jacobs. I appreciate the outreach that the VA has already done, both directly and through veteran service organizations. And it's been important. It's let veterans know about the new benefits and health care that they may be eligible for under the Act. I continue to hear from veterans in New Hampshire, especially the VSOs, about how helpful those communications have been. So thank you. But there is a concern that veterans who aren't already connected to the VA or the broader veteran community are not getting the information that they need. And we've talked a little bit about that up here, but I want to drill down on a couple of things. In particular, I want to make sure that the VA is targeting outreach to service members who will be separating or retiring from the military in the future, but likely aren't actively connected with VA services today. You talked a little bit about information about the PACT Act and the Welcome Kit, but how are you coordinating with the DoD to make sure that this population learns about the PACT Act now so that they can be better prepared when it comes time for them to enroll in health care or disability claims?
I'm happy to start, Senator. This is a major area of focus for us. The critical period of transition into civilian life for veterans is very a vulnerable one, and it's a perfect opportunity for us to introduce VA writ large, but also the benefits under the PACT Act. We're making use of the Transition Assistance Program, TAP, and many other ways of doing that. I'll ask either Mr. Kiyakawa or Mr. Borsler to give us some more details about that.
And I get the focus on transition, but even before transition, what's happening?
Well, in the first instance, we are actually collaborating with DoD on outreach. So we've already had excellent meetings centrally with the DoD's Public Affairs Office. DoD has regularly events that for military outreach, everything from fleet weeks, air shows, military bands, base openings, ship christenings. We're really going to be at as many of those events as possible, and also invite our DoD stakeholders to the 50 events during PACT Act Week of Awareness on December 10th. Any of my colleagues want to supplement?
I can also add, we have a pretty robust governance process where we partner with DoD. It's led by Deputy Secretary Remy. Okay. That's part of the Joint Executive Committee. Underneath it, there's the Health Executive Committee and the Benefits Executive Committee. I co-chair the BEC. I'll be at a meeting with my DoD colleagues on Friday, and one of the key points I'll be raising is how do we get the word out? How do we continue to put our foot on the gas, communicate to transition service members before they're even.
Well, that's helpful, and I thank you and will encourage you to continue planning for and supporting this group of veterans. I'd also like to note that the calls made as part of the Solid Start program to newly separated and retired veterans can be an effective tool as well. Let me move on to one other issue in my remaining time, and this is to Dr. Elnahal. As you know, the VA needs to increase its workforce to provide veterans with their new benefits under the PACT Act. This need is particularly acute in rural communities in New Hampshire and across the country where attracting health care providers is a challenge. Section 901 of the PACT Act requires the VA to develop and implement a national rural recruitment and hiring plan for healthcare professionals to better reach these underserved communities. I'm glad to hear that you're already working on this plan and you expect to complete it, I think, by early 2024, if I understand the testimony. How is the VA developing the plan, and are there any details from the plan so far that you can share with us?
That's right, Senator. It's a really important part of what we need to do to target our hiring efforts more effectively in rural areas. As you know, these are more difficult healthcare labor markets. It's harder to get folks recruited for these critical positions. We are actually approaching this in, I think, an innovative way. We're taking our experts in workforce management and human resources and combining them with our implementation science researchers to collate the data that is available to understand what a targeted outreach plan could look like and make that actually an evidence-based effort. Okay, I'll ask Ms. Therrett if you want to provide more details.
Thank you.
Thank you, Senator. So we have an integrated project team that meets on a weekly basis, and we update the status of this. I will be candid and say that we focused on the workforce authorities that we could implement right away, knowing that this had the 18-month timeframe to
Yep.
submit the report. But we can provide you and your staff with updates as we develop the plan and really focus on what we can do to get the workforce that we need in those locations.
That would be great. Thank you so much. And again, thank you all for your work.
Senator Moran.
Chairman, thank you. Dr. Ellenall, welcome. I'm worrying about